This is Fox News First.
Welcome back. In recent years, there's been a heightened emphasis on mental health, especially in young people. And here in San Antonio, one local facility is helping kids ages 3 to 17 to deal with the challenges that can come with depression, anxiety, and mental illness. And we want to talk about that right now with the CEO of the Clarity Child Guidance Center, Jessica Knudsen, who is here. You did not come empty-handed.
I did not.
These gigantic cookies that we say are as big as your face. And we're going to talk about these in a minute because these are actually very special cookies here. But let's tell our viewers about what you do, because I'm a parent and there's so many parents out there who have kids in that 3 to 17 range. And let's face it, the last few years have not been easy to say the least.
They've been very rough.
Yeah, so where do you guys come in?
So Clarity is the only nonprofit behavioral health facility in South Texas that is dedicated to the treatment of kids ages 3 to 17. And we do an inpatient program, so 66 beds for kids that are really in crisis. We have a day treatment program and then a full complement of outpatient services. So we're really able to help no matter what the issue is,
right?
From minor to really more severe issues.
And so what do you tell parents out there who might be having a rough time with their child right now? Maybe they think they can handle it, or at what point do they need to reach out for help and maybe contact you guys?
So parents are the experts on their kids. I mean, they know them far better than anybody else. And I would just advise a parent if they're seeing any change, any significant change, and that can be change in sleep and eating pattern and socialization, but anything that's a shift for their child, to reach out sooner than later, because you don't want, unfortunately, a lot of the research shows that it can take up to 8 to 11 years to get treatment before the onset of a symptom and actually getting into treatment. And we want to get in front of that, because our ability to really have impactful change increases if we can get in there early.
I would think, too, it would be difficult for some parents to come to terms with the fact that we need help, or maybe there's a misconception about what you guys do, that it's whatever about your facility that it's not going to work out.
Right.
Yeah.
It's unfortunately there's still so much stigma and even blame and guilt when we have these mental health diagnoses, and so we're really trying to have discussions around that and normalize it. The comparison I make a lot is, if you think about a kid that was in kindergarten at the start of the pandemic, we picked them up, plucked them back down in second grade, and now we're all shocked they're not acting like second graders.
Right.
And so it's just part of our recovery from this kind of shared trauma that we've had the last few years.
Mine went from 4th to middle school. I mean, and so I mean, I totally get what you're saying. So, and it's this where the cookies come in. So this is pretty cool what you guys do, and there's a reason why these are so gigantic.
Yes.
So tell us about that.
So back in the 1970s, because Clarity's been around 136 years in our community, but in the 70s we had a dietary director named Arnold Parker, who everyone loved his chocolate chip cookies. He made them daily for dessert, and he got inspired one day to make an oversized cookie to present to children when they discharged from our inpatient program. It was a big hit, and we've continued it since the 70s to this day. So every child that leaves inpatient gets one of these oversized cookies.
And they say they're cookies as big as your face, and that's quite literally, and I have a pretty big face. You can see it right there. You know, and I was reading too that before the pandemic, I mean, some of the numbers were trending downward in terms of mental health and young people, and COVID probably made that worse.
Yes, we have definitely seen an upward trajectory in needs across inpatient, outpatient, huge demand for services. Unfortunately, Texas only has about 37% of the mental health providers to meet the need across kids and adults across the state of Texas. So there's definitely a huge demand out there. Without
getting into too many specifics, I mean, what are some things that you would do at your facility, or things that you've seen that have helped and that have worked over the years?
You know, sometimes it just starts with having a frank conversation about what's going on. We get afraid to ask about these things sometimes. We get afraid to ask someone if they've ever thought of hurting themselves. And sometimes it's just sitting down and having a frank conversation can really jumpstart a lot of things.
And that's where I guess, you know, we talk about parents just being on top of their kids with social media, and it may feel intrusive in some cases, but just, you know, if you see that they might be self-harming or change in behavior, like you said, diet, those kinds of things.
Absolutely. And, you know, sometimes our staff will just help facilitate that conversation. If a parent is unsure how to ask or what to ask, they need that professional to really guide that conversation. Yeah,
and we always like to remind our viewers here, there is help in San Antonio. You don't have to go out of town, across the country, out of the country. There's help right here in San Antonio, and there's no shame in asking for help.
And we are open 24 hours a day, 7 days a week for anyone that's in crisis. They can walk in. They don't even need to call ahead. You can walk in and get seen by a mental health professional, and we'll help you through the process.
And it's really cool. I know Mr. Parker is no longer, with you guys, and obviously, but his legacy continues on.
Yes.
I think it's pretty cool what you guys do. It's just kind of like a physical representation. As it says on the box here, you are one smart cookie, and you guys are doing some amazing things right now. So we appreciate it. If people want to find out more information, they can find you online. It's ClarityCGC, childguidancecenter.org.
Correct.
ClarityCGC.org. And again, they're a nonprofit, so they could always use your help as well if you feel inclined to do so.
Absolutely.
Great to see you, Jessica. Thank you so
you for
much.
having me.
Okay, very good.